peaks of the virus. So that's probably what most providers, most people would say is the best we have. However, with that being said, you know, you can have false positives and false negatives with that test. And so as a provider, we have to look at both the clinical side, which means how is this patient presenting, what kind of symptoms they're presenting with, and then we always do the test to confirm what we think might be going on or rule out what we think may or may not be going on. So the tests are based on what we think is going on with our medical information and the things we know about how diseases work. We then do the test based on that. And as you know, and you mentioned earlier, this COVID-19, even the most learned virologists around the world have all stated that this is the worst virus that they've seen. This is a nightmare to people that are experts in the field of viruses and how to treat them. And so we're dealing with something that's really really complicated and very dangerous. And I think that we have to kind of look at it that way. When we talk about wearing masks, washing your hands, social distancing, we have to really, that's, you know, it's kind of interesting because that's our best defense against this virus is a mask, gloves, or washing your hands, and staying a certain distance away from people. And when you think about that, I mean, what other disease have man has not had another disease where that is the main way of fighting this thing. And so we all have to take it. We've got to take this thing serious. It's dangerous. And for those of you that know people who have experienced this, you know it's pretty toxic. Yeah, and now it's starting to. We have seen more younger people between the ages of 25, 35, 40, come in with these symptoms now. We're starting to see a lot more younger individuals with COVID-19.
There has been a new symptoms. Can you talk about some of the new symptoms that have recently been discovered?
Absolutely, and I think that it's good for the public to know that initially when this first started, it was shortness of breath, fever, cough. And so we kind of all look for those symptoms, flu-like symptoms. But this COVID-19 goes far beyond that. And if you start to talk to people that are knowledgeable, you see there's a whole host of symptoms. People can lose their smell. People can lose their sense of taste. People can just present with nausea from nowhere, confusion, diarrhea, severe muscle pain, eye symptoms. So there's a whole host of other symptoms that we have to be aware of. And so what I would recommend, or what I would tell patients or people in general, is if you're feeling unusual in any kind of way, whether it's respiratory, breathing, chest pain, vision, GI system, your stomach pain, muscle pain, joint pain. If you're having those symptoms out of nowhere, just all of a sudden you're starting to have, you can feel that you're having these symptoms. I can't smell anymore. For some reason I don't smell, or or food doesn't taste the way it used to. You need to at least get to the doctor and ask to be tested and be checked out.
Can you talk about how long the symptoms can last?
Right. And it's kind of funny because not funny, but it's kind of interesting,
Right.
because I think in most of our minds we have this 2-week length of time that if I have COVID-19, then after 2 weeks I'll be fine. There are people that have had COVID-19 symptoms, residual symptoms lag on for 2 to 3 months. Fatigue, inability to sleep, inability to think clearly and quickly, stomach pain, muscle pain that just kind of lingers on. All of these things kind of come with this virus. I've known people, I have had some colleagues that have been hit pretty hard with the virus, can't walk anymore, can't think clearly like they used to. Severe headaches ongoing for 2 to 3 months. And so some of what we hear in the public about it's 2 weeks and then everything will be fine, that's a certain percentage of the population. There's a certain percentage of the population that really have severe symptoms. They're hospitalized. And then also there's a lot of people that after they have COVID-19, they have these lingering residual symptoms that, this fatigue that won't go away completely, the headaches that won't go away completely, diarrhea, constipation. So this virus is unpredictable. It's just so unpredictable. When you look at the studies around the world, in Britain, the UK, Australia, France, all the scientists around the world are doing these different studies, and they're coming up with different outcomes. And they're seeing that patients are responding to different, they're responding differently to this virus. They're not, it's so hard to pin down. And so I think that we must keep in mind that there's not any hard, fast rules about how this virus presents.
Can you also talk about the mental effect on the COVID-19?
Yes. I think that people have, a lot of people are going through a lot of depression and anxiety. All of a sudden you have, you have no contact with your family. Say your parents, if your parents don't live with you, you can't see your parents. You can't see your other siblings. You can't really interact with them. Your friends, you can't really interact with them like you were. That can be, you're isolated. We've been told to don't leave your home. Isolation. Part of depression and feeling bad is isolating. I mean, you want to isolate. You don't really want to be around many people. You don't want to talk a lot. And here we have a medical disease that is confining us, that is making us be at home. Um, and, and that right there brings on a lot of depression and anxiety, which leads to other problems, drugs and alcohol. Um, you know, people are getting aggressive with one another, anxiety, frustration is building up. And so you have a whole society that is going through a whole emotional, mental thing. And I think that we have to, you know, we have to realize that we're, you know, we are emotionally upside down. And we have to really try to talk to one another about those kinds of things. Take walks when you can. You know, we have the new normal is going to be the new normal. So there again, when you talk about mental health, there's a grieving that we're all going through, because what was what once was is not now. It is no longer exist. And so anytime you lose something, there's some grieving, a grief period. And you know, for a lot of us, we've lost a lot. I mean, people have lost their jobs. They've lost relatives to COVID-19. People have died. Our kids no longer are. We worry about their education, and so we've lost the way that they're educated. So deep inside of us, our soul is grieving, and you know that's a real thing. And so we have to we have to face that, and we have to talk to each other. We really do have to talk this thing through, because we don't want people to start committing suicide, or you know, there's a lot of aggression and aggressive things that are going on. And so the mental health piece is really, really important. And so I would urge all of us, I mean, to find somebody that you can talk to, and reach out by phone and talk to your family, your friends, and tell them how you're really feeling. You can't, this is too much to hold in.
It really is.
And I think even for the kids, we need to really, you know, the kids are grieving, and kids don't know how to express that. All of a sudden, they can't, you know, they can't play with their friends. Everything changed just like that for the kids. And so not only do we have to take care of ourselves emotionally and mentally, we have to look at our family and our kids. And so when you talk about mental health and what this has done to us, you know, what role this has played, it's pretty significant. I think even, you know, even for people that haven't contracted COVID-19, you're worried about if you're going to contract it, and what will you do if you contract it? What if you get really sick and you lose your job, and what happens to your job? And you know, so there's a lot there when you talk about mental health in this COVID-19.
Who should test for antibody blood test?
Oh boy, that's a real that's a good question, because because people don't really understand. Most people that come to me and talk to me about the antibody test are people, they hear that there's another test, so they want to have all the tests. I want to have all the tests that are out there to make sure that if I have it, or if I don't have it, or I had it. And but if you read the literature and you look at the studies around the world, these antibody tests are not as sensitive and specific as we would like them to be. We would like, let me kind of explain to you what that antibody test is. When a person is infected with the virus, we will develop antibodies against the virus, the flu, the COVID-19, a bacteria. Our bodies make these antibodies, and these antibodies will fight the organism. With COVID-19, because it's such a complicated virus, we kind of think that if we test for the antibody and we have the antibodies, then we're protected. But there's been no significant studies as far as these antibodies that our bodies produce against COVID-19. We don't know how long, if let's say your body produces antibodies, and so one would think the logic would be, I'm protected. We have no hard clinical scientific evidence to say that since you have developed antibodies, then you're covered. You have immunity against this virus for 90 days or for 6 months. That we don't know that. We really don't know that. And a lot of the studies that are being done with the antibodies have been done on people that have been hospitalized and have been severely ill. So when you look at people outpatient wise, they may have no symptoms, they may have mild symptoms. When you talk about getting the antibody test in that situation, I don't know how much value that is. I don't know what getting the blood test is what more that's going to give you. Is it going to give you a false sense of security that I got the antibody test and it showed that I had some antibodies, so now I don't really have to wear the mask as much as I need to, or I don't have to. One of the things that I am trying to do and remind myself when I go into an establishment, like going to the store, I want to put gloves on my hands while I'm in the store, and then when I come out of the store, I want to take those gloves off and throw them away, and then use hand sanitizer. To me, that's a good way of protecting myself from touching things in the store, say, and then I get outside the store and my eye itches and I rub my eye, and I have, let's say I've touched a surface that somebody who's positive has touched. Maybe they sneezed or coughed or rubbed their eye, and they put their hand on the counter. My hand's on the counter now, and I get outside and I wipe my face or rub my eye. So all these little things that we don't really think about, we have to start thinking about. And so I think one way would be to get a box of, this is just a recommendation, is to get a box of gloves. Anytime you go inside a place outside your home or your car, put the gloves on, go in, take care of your business that you need to take care of. When you get back outside, remove the gloves, keep a little hand sanitizer in your pocket, wash your hands, and get in the car. Because the last thing you want to do is put your hands where somebody has had their hands that's positive, whether it's in the store or getting gasoline at the gas. I mean, you know, we got to get gas for our cars, and so we don't want to pick the pump up, and you know, hundreds of people have put their hands on the pump. Got to have gloves. I mean, you just have to have. I think you have to have gloves, and it'd be real beneficial for you to have gloves, and also to have a little container of sanitizer in your pocket to wipe your hands off after you take the gloves off.
And finally, have you seen a case where someone was positive for COVID-19 and then they recover? Then again, COVID-19 came back to them. Is there such a cases as can COVID-19 come back twice to an individual?
Right. Now, I have not seen a case where someone was positive for COVID-19, excuse me, positive for COVID-19, had symptoms, was tested, and then was negative, and then a month later, they came back with more symptoms and tested positive again. I haven't seen that case yet. I haven't seen that patient. I've seen people that have been positive for 6 weeks, or they tested positive 4 or 5 times simultaneously. Week after week, they're positive. And we don't know what that means. I mean, and they don't have symptoms. At week 4, week 5, week 6, they don't have symptoms, but they're positive. What do you do in a situation like that? They're completely, they completely have no symptoms. They feel great, but they're testing positive. Well, yeah,
it's kind of strange. There are some cases I've seen some Somalis in UK, unfortunately, who have came down with the virus twice. And I think last show that you and I had, you spoke about the lack of vitamin D deficiencies could be the major player.
absolutely, absolutely. I would re-emphasize that if one of the things that you can do is go to your healthcare provider, get tested for get vitamin D levels, see where your vitamin D is. If you're vitamin D deficient, if your vitamin D is 12 or less, you need to be on vitamin D. We talked about the role that vitamin D plays in our immune system and how it helps fight against all different respiratory illnesses. And so we definitely, I'm encouraging people to get their vitamin D levels checked, and then also talk to your provider about how much vitamin D should I be taking. I think I mentioned this in the first talk, but I will say that with the fall coming up, it's quickly approaching. August is next month. It'll be August. Going into the fall and winter, I would really encourage people to try and get their vitamin D levels between 40 and 60. And that's something that I would have a talk with my provider with. Does that range seem reasonable? I heard Dr. White talking about vitamin D being between 40 and 60. Is that true? So I really do think that we need to encourage, especially people of color, where we don't have that vitamin D converted over into the active vitamin D form in our bodies, we definitely need to get our vitamin D's checked, and if we and be on supplement if our vitamin D levels are if we're vitamin D deficient.
Well, viewers, that's Dr. Mark White with Gateway Health and Aware Center. Dr. White, as always, great information. We will see you next week.
Thank you very much. It's always a pleasure to come on and talk about health and wellness.
Thank you.